Hello, Namaste. In this video, we will know about Vesico ureteric reflux, which is also just called as urinary reflux. So, this is what our urinary system looks like. It consists of two kidneys, the ureters, and the bladder. So, the function of the kidneys is to filter out the waste products from the blood and to form urine. This urine then travels through the tube, which is called ureters, and into the bladder, where it is stored, and then finally it is then removed during voiding, that is during urination. So this travel of urine through the kidney, the ureters, and the bladder is a unidirectional process. That is, the urine can only travel in the one direction, that is towards the bladder. But it the bladder does not allow the urine to go back into the ureters and stops it at the junction of the ureters, that is these urinary tubes with the bladder. This is feasible because there is a valve like mechanism at the junction which does not allow the urine to pass through. So if this valve is not functioning properly, then the urine from the bladder can travel up the ureters and enter the kidney. And when this happens, these ureters now start widening and dilating. And because of contouring reflux, the ureters may dilate more and they can ultimately become more tortuous. So once the ureter becomes more tortuous, that is, they have a wavy like pattern rather than straight tubes, the urine can easily stagnate inside, which is a very good culture media for the bacteria to grow. So the bacteria can now pass from the bladder into the ureters and then damage the kidneys. They can cause infection in the kidneys, which is called pyelonephritis, is a severe form of urinary tract infections, and this infection can then permanently damage the kidney, leaving scars on the kidney. So before we go further, let us understand how this valve. So this is the bladder and these are the two urinary tubes, and we know as soon as the urine enters the bladder, it distends to accommodate the bladder, and this is how we are able to store few hundred ml of urine in our bladder. So in a normal anatomy, this is the normal anatomy. So this ureter enters into the bladder in a oblique course and runs parallel for some time into the bladder and then opens into the bladder. So this acts like a valve-like mechanism because as the bladder distends because of urine, the pressure in the bladder increases and it presses upon this tube, compressing it so that the urine cannot go back into the ureters. But once this valve is lost because the urine ureters open directly into the bladder, the urine can easily travel up the ureters, resulting in reflux. So now we will talk about some treatment options that are available. But you must understand that all these decisions have to be taken after consulting your pediatrician and your pediatric surgeon or urologist to define what is the best that is suitable in that particular case for that particular patient. So the cornerstone of the management of the reflux is prevention of urinary tract infections. For this, the patient may be kept on very low dose of antibiotics so as to prevent infections, and the parent should also be very watchful that if the child has any features sensitive of urinary tract infections in the form of having pain during micturition, having a fever without any particular reason, having pus in urine, then they should start consult their doctor and send urine examination and start appropriate antibiotics. So this low dose administration of antibiotics is necessary, especially if we are doing a conservative approach. That is, we are waiting and watching the patient and hoping for a spontaneous resolution of reflux. This spontaneous resolution can happen as the child grows. The ureter may also grow, the bladder may grow, and probably this reflux can resolve on its own. But a very watchful follow-up has to be done with your pediatrician or the pediatric surgeon so as if there's any damage to the kidneys, these patients can be immediately taken off this conservative approach and operated. So the surgery is indicated once we know that kidneys are undergoing damage because of these infections. So if there's recurrent infections and there's a severe reflux which are damaging the kidneys, then the surgery is indicated in these patients. So there are a number of surgical procedures that have been described, but the aim of all the surgical procedure is to recreate a kind of a valve-like mechanism at the junction of the ureters and the bladder so that the urine cannot go up the ureters. So it would involve again changing the course of the ureter, that is ureter is disconnected and again reimplanted into the bladder in a manner that again it has a tunnel-like course through the bladder which does not allow the urine to reflux. So another option that is recent and is now available is injection of a bulking agent at the junction of the ureters and the bladder. They are coming with the market name of Reflux and Dexel in India. So these are very inert agents which form bulk in that particular area once they are injected. So this procedure is carried out as a daycare procedure in which there is no incision given and through endoscope this bulking agent is injected with a particular technique at the junction of the ureters and the bladder. And once that happens, it does not allow the urine to go back into the ureters. The only shortcoming or the problem with this injection is the cost. The cost of this injection is upward of 35,000 rupees per ml in India, and injection on each side may require 1 to 2 ml. But even if this injection is performed and it fails, it doesn't mean the surgery cannot be performed. The implantation can again be performed if the patient fails after this surgery. The success rate of this injection may vary with the anatomy, with the type severity of the reflux, and with the experience of the surgeon and the patient factors, of course. I hope I have helped you to understand more about this disease. Thank you for your time.